अच्छा अभी कुछ मत बोल, रिकॉर्डिंग स्टार्ट हो गई.
So this is the sternum. The sternum is divided into three parts. The upper part, that is up to the first vertebrae, there is the manubrium. From the manubrium to the lower xiphisternal process, that's the body of the sternum, and this is the xiphoid process or xiphisternum. Now coming to the manubrium has four borders: the superior border, two lateral borders, and one inferior border, and two surfaces: the anterior surface and the posterior surface. The superior border has a notch, jugular notch, through which the trachea can be palpated, and this notch lies at the level of T2 thoracic vertebra. And behind, laterally to the notch, there is lateral to the jugular notch. Lies the clavicular notch where the clavicle attaches. Talking about ligament, एक तो हो जाए तेरा interclavicular ligament, capsular ligament itself, the investing layer of deep cervical fascia इधर रहेगा. इतना ही है ligaments फिलहाल. और आप मसल अटैचमेंट पे आ जाते हैं. Superiorly the sternal head of the sternocleidomastoid अटैच होगा, और इधर से laterally ही from lower part मेरे pectoralis major का insertion origin शुरू हो जाएगा. Coming to the posterior surface ऊपर laterally present रहेगा sternohyoid, उसके नीचे sternothyroid. फिलहाल तो इतना ही है. Then coming to the body has two ends, the upper end and the lower end. The upper end fuses with the manubrium and makes a angle known as the sternal angle or the angle of Lewis, which is 5 cm below the jugular notch and at the level of the T4 and T5 thoracic vertebrae. So this is the upper end, this is the lower end, two lateral borders. These are the two lateral borders, and two surfaces, the anterior surface and the posterior surface. At the junction of the manubrium and the body, there lies the facet for the second costal cartilage, and the facet for the first costal cartilage lies laterally to the clavicular notch. Coming to the attachments, the anteriorly the pectoralis major muscle attaches laterally of the body. Now coming into the posterior side can be divided into two parts vertically, the left and the right part. The right part has a reflection of the right lungs and right pleura. The left part can again be divided into two halves, the superior and inferior half. The superior half has the reflection of left lung and pleura, and the lower half has the reflection of the pericardia. Coming to the and one more thing, the body and the manubrium makes the joint, manubrosternal joint, at the angle of Lewis or the sternal angle, which is a secondary cartilaginous joint. T4. Now the xiphoid process. This is the xiphoid process, which is a sword-like T-body sword-like process. This fuses with the body at the inferior sternal joint or the xiphisternal joint, which lies at the level of T9, and this is a primary cartilaginous joint. The xiphoid process itself has origin and insertion of several muscles. Coming to the anterior surface of the xiphoid, it has the insertion of rectus abdominis, external oblique muscle of the abdomen, and internal oblique muscle of abdomen. Laterally, it gives origin insertion into transverse abdominis and internal thoracic muscle of abdomen.
Internal thoracic muscle of the abdomen.
Posteriorly, it gives origin to the diaphragm from two slits. Now from the tip of the xiphoid,
खाली diaphragm origin है, बाकी सब insertion.
और at the और tip से तेरा linea alba जाएगा, जो rectus linea alba.
Linea alba.
जो rectus abdominis को दो हाफ में डिवाइड करेगा.
Linea alba dividing the rectus abdominis into two.
Linea alba वो rectus डिवाइड करने की जरूरत नहीं.
Linea alba
present at the tip of the xiphoid process.
हाँ.
इसी है जो है.
हो गया ना?
बस.